Now, the next is another interesting chapter. That's kshudraroganidana vyakhyasyaamah yathovata bhagavandanahi. Kshudraroga, that word itself is a bit of a confusing issue. Why the name Kshudra comes to this Kshudraroga, there is no definite answer. There are many versions. There are many people who claim that the Kshudrarogas do not have, or they mean to have a relatively less significance on the body, and they are relatively easily curable. But that fact is not true. There are many Kshudrarogas which can be quite fatal and quite severe. And kshudrarogas also are suggested to be skin disorders. It's not really the skin disorders alone. Rather, what I would feel is kshudrarogas are those which produce a visible deformity, or the patients would have a tendency to hide those disorders generally, socially, not so acceptable. Maybe such disorders are those which produce a deformity could be considered as a kshudraroga. Or maybe it could be the other way also. The incidence of the disease when it is less common, it could be considered Shudroga, whereas the incidence of the disease which is more common could be considered as a Mahavyati. So you may have different versions of the logic behind naming this Shudroga. Anyway, there is no definite answer for this question, like why they considered as a Shudroga. There are some more confusing issues. Some of the diseases which are mentioned in the Kushta Prakarana, they are also mentioned in the Kshudraroga, and the etiology and all the description is the same as such. And again, why when it has to be considered as a Kshudra or when it has to be Kushta? Probably, I would say like when the symptoms are relatively milder, then they could be considered as Kshudraroga. When the same disease which produce a severe symptom may be considered as a Kushta, like Parma, Vicharchika, Rakasa, these are the varieties of the Kushta also. So in the Kushta Prakarana again we have referred to that issue. So there are a bit of such areas where there could be a relatively no definite answer. Anyway, in general, Sushruta has considered 44 चतुश्चत्वारिंशत् क्षुद्रोगाः भवन्ति तद्यथा अजगलिका यवप्रख्या अन्धारति विवृता कच्छपिका बल्मीकं बिन्दवर्धा परसिका पाषाणगर्दभः जानगर्दभः कक्षा विस्फोटकः अग्निरोहिणी चिप्पं कुनकः अनुशयी वितारिका शर्करार्बुदं पामा विचर्चिका रकसा पाददारिका कदरम् अलसा इंद्रोत्तौ दारुणकः अरुंशिका फलितं मसूरिका यवनपीडका पद्मिनीकण्टकः जतुमणिः मशकः चर्मकीलः तिलकारकः न्यक्षं व्यङ्गः परिवर्तिका औपाटिका निरुद्धप्रकर्षः सनिरुद्धकुदः ऐपूतनं शुनकच्छुः उदध्वंसश्चेति. Now, which are those as such, the clinical symptoms? Now, first of them is the Ajagalika. Ajagalika is considered to be a disease of children, maybe an age, pediatric condition, and the lesions occur as eruptions with the same color as that of the normal, where there is no discoloration. Now, snigdhaah, savarnaah, ghratidaah, nirudaah, mudgasanibaah, kaphavatotchitadnyeya, balanam ajagalika. Ajagalika, the eruptions tend to occur over the surface of the body, which are usually cumulated, gratidaah, cumulated, or where you will have aggregation of multiple eruptions together, and their surface is smooth and the color is the same as that of the normal tissue, and they are produced due to kaphaja and vataja vyadhi, kapha vataja vyadhi. Now, it's a very frequent incidence in neonatal conditions, children, like a sebaceous nevus. Nevus, of course, is a birthmark, and when the nevus is produced due to enhanced sweat glands, these tend to present as eruptions, exactly the same as described by Sushruta. Savarna, Grathita eruptions over the Nirjaha, painless. And size, of course, Sushruta is Mudgasanibaha, may not be the size is limited to the size of a green gram, but it could be smaller or bigger, but usually a relatively firm eruption seen over the surface of the body, quite frequently over the head, not necessarily over the head. See, the sebaceous nevus, they are more common in any hairy areas of the body. Of course, head is more common, and it can occur elsewhere in the body too, and it's a relatively painless and harmless condition. Generally doesn't require any specific treatment. Only for cosmetic purposes it may require a treatment, and the treatment would be the laser treatment to remove that. That's all the issue. Or The molluscum contagiosum is an infective disorder, and of course, I would refer to this issue in the Shukaroga also, which can occur in the adults. It may not be in children, and it also has something to do with the sexual activity, and it can occur in immunocompromised conditions where the lesions could be again similar feature like where the color would not be changed, relatively firm and accumulated or aggregated ones. These tend to occur in adults. So if we limit that Ajagalika to children, it's the sebaceous nevus, and if you widen that the scope into the adults, it could be as in case of the molluscum contagiosum as such. Then the next is about the Yavaprakhya. Yavaprakhya, Yavakaraha Sukatinaha, Gratiraha, Mamsasamshiraha, Pidakaha Shleshmavatabhyam Yavaprakheti Sotyade. Again, a Kapavataja means it's a painless and very firm in consistency, where the shape would be like Yavadhanya and Kachinaha, very hard, firm, Gratitaha, again they tend to be accumulated, Mamsa Samshiraha, related to subcutaneous tissue. Now these are exactly what we see in case of the neurofibroma, nodular neurofibroma. Neurofibroma again can occur of different varieties, but a nodular neurofibroma is characterized by a painless, firm swelling having a smooth surface and of course hard. And it's most of the times the location is in the subcutaneous tissue, again which also does not have any specific curative treatment. The only treatment possible could be excision as such. And when it is on the surface of the body, it may not be harmful, it may not produce any symptoms. Whereas if the neurofibroma is in the deeper plane and produces a compression upon the neighboring structures, it can produce the symptoms. It can be quite severe also when it is intracranial or within the central nervous system. But most common are the subcutaneous neurofibromas, and they also are quite common entities. Then the anthology is the next of the condition. Dhanam, avakram, pirakam, unnatam, parimandalam, andhalajim, alpapuyam, tam vidyat kapavatajam. Now again, these are all the kapavatajya vyadhi in the beginning. The difference would be in the kapavatajya vyadhi, the first of that ajagalika, it will be relatively firm and there is no discoloration. Whereas Evaprakya is very hard and firm, and in both the conditions there will be no discharge. Whereas in andhology, there will be slight amount of the discharge. When you cut open, you will find somewhat thick liquid-like condition, and it doesn't spontaneously open frequently. It doesn't open up frequently as it only when you open, you will find some thick liquid, and it also has a induration. Around the area, you may see an induration. Parimandala is a induration. Ghanam, it's a relatively firm, and when it is opened, it's a alpapuyam. There will be slight small amount of secretion seen, and that condition is called as a andhology. So in the kapavatajya vyadhi, you will have these kinds of variation, and these are seen in what we call as a cystic acne. Now acne as such would be of different varieties. We will come to that part when we discuss about Devana Pitaka. There I will be referring to this issue again. But among them, the cystic acne is that condition where the cyst gets enlarged. The cutaneous cysts, sebaceous cysts, sweat glands, they tend to get enlarged, distended, and they will be accumulated by, or they will be filled by a solid, somewhat semi-solid, gelatinous substance, and that produces acne, and it could be widespread. And it's usually independent of the hormonal changes. That cystic acne is independent of the hormonal changes. And often it leaves scars, hard scars can be seen later. So cystic acne is one of the varieties of the acne which you see. And of course, treatment also is quite difficult. And again, kapavataja vyadhi. Then the next is about the pitta lesions where there could be inflammatory pathology. The first three are the non-inflammatory conditions. Inflammatory conditions. Now you can see a gradual progressive description of the clinical conditions. Non-inflammatory, inflammatory, and so on, and the consistency changing from hard to the soft as such. In case of Vivrta variety, the Vivritasya Mahadaham Pakwa Udumbar Sanibam Vivrta Vichitam Vidyata Pitotharam Parimandalam. Now, in case of the Vivrta Vyadhi, they are presented as a Pakwa Udumbara, like reddish discoloration produced due to the inflammation, and due to that inflammation, there will be accumulated pus, and that pus tends to be seen through an opening. Now, it's a very typical of a infected cyst. It could be any cyst. Sebaceous cyst is quite common to be infected. Any other subcutaneous cyst they get infected. When they get infected, you will have a limited area of inflammation, perimandalam. You will see that a ring-like appearance around the area or slight induration, and it has a tendency to open up on its own. That opening or the punctum could be seen, and at times the punctum could be ruptured and opened. Then it's a typical vivartasya, or a tendency to open will be seen. So infected cysts can be considered as a vivarta vyadhi. Then they again a similar lesions where the lesions tend to occur, and they will be painful. There could be slight discharge, and they are the kachapika. Krachitaha panchava shadva dharanaha kachaponnataha kapha pirakaha jnaya kachapika budhihi. It's a kapha vataja vyadhi, where you'll find the lesions which are relatively accumulated, or they tend to have multiple, and Sushil says Panchavashadva, 5, 6 in the sense, it's not necessary that the number should be 5 or 6, multiple, but not very too many, so moderately number conditions, and hence, and they are presented as having a raised surface and slight discharges, like, and this is exactly what we call as the granulomatous abscess. Granulomas are usually signs of a chronic inflammation. We have referred to that issue of granuloma in some other sessions, like in any infective process, when the suppression is not successful, there will be a formation of the giant cell layer around the area of inflammation, and that form is called as a granuloma. It could occur due to a foreign body, quite frequently a foreign body granuloma, or it could occur due to non-suppurative organisms like tubercular organisms. The granuloma can occur, and such an abscess is a granulomatous abscess, very commonly seen in foreign body issues. What we see here is the same, where you will find that the surface is raised, and there is a relative firmness around, tendency to have some discharges, moderate discharges, and when you open up, you'll see a fleshy tissue having relatively harder consistency, not very hard, moderately hard as such. Then the next is Valmika. Valmika, the word Valmika means a prawn, hutta. Now, when a lesion which tends to occur, Panipadatale Sandhu, Grivayam, Urdhvajatumi, Granthi, Valmikvadyastu, Shani, Samupachete, Todakreda Paridaha, Kandu Madhi, Mukhi Vrataha, Vyadhi, Valmikaityeshaha, Kapavitta, Anirodhavaha. It's a Tridoshaja Vyadhi, where they tend to occur at some specific areas where there is a skin fold, like Panipadatala, or the skin is thicker, as in case of the palmar or the plantar area, or in the areas where the skin is having folding and stretched, like Grivaya Murdhajatun, or the neck or the face area, you will have a granthi which tends to present like a front, that's multiple openings are seen, typically multiple openings are seen, and you'll have all the signs of inflammation like pain, discharges, and even occasionally foul smelling contents there. And this is what we typically see in case of the actinomycosis. In the actinomycosis is a sort of fungal origin, and it can occur anywhere in the body, any system could be involved, but cutaneous actinomycosis is more common, and very frequently the location is in those areas where the skin having a fold and where maintenance of the hygiene is not so easy, like axilla or inguinal area are the more frequently involved areas. It could occur elsewhere too, in the breast also. Actinomycosis can occur in the breast too quite frequently. It can occur anywhere. Any system could be involved. Intra-abdominal actinomycosis also is well known, but it's related to the surface. When we discuss about the kshudraroga, it's about the cutaneous actinomycosis, where you will find a very chronic condition. Condition tends to be very chronic, repeated episodes of pain and discharges. The openings, they seem to be healing, and again there will be slight discharges. This is typical of the actinomycosis, and it's quite troublesome. And of course, in a typical actinomycosis, you will have a sulfur granule-like pus. The pus would be having yellowish sulfur-like appearance. That's very characteristic of the actinomycosis, and this is again one of the common fungal infection which we see. Then the next is about the Indravrudha. Indravrudha is presented as a Padma Pushkaravat Madhye Pidakabhismachitam Indravrudham Tam Vidyat Vatapittotsam Vishaka. Now, a lesion which tends to spread in a pericircumferential manner. Now, whenever we describe the lesions now, cutaneous lesions now, we discuss them as either a circumferential, where they may just or centripetal or centrifugal description. Centripetal in the sense a lesion starts in the center and then it tends to spread towards the periphery, whereas centrifugal is the lesions would be in the periphery and they tend to merge or come towards the center and involve the area. Now, Sushruta has given that description as a Padma Pushkaravata, like the pond of a lotus flower. In the lotus flower pond, the first lotus would be in the center, then the next generation of the lotus would be in the periphery. So that kind of a description. So very beautiful description of the centripetal distribution of the lesion or extension of the lesion. So a lesion starting in the center, then tend to go to the periphery. Now, such a centripetal lesions could be of two forms, where there may not be a central healing, as you see in the first case, whereas in some other cases there could be a central healing. A central healing and then a peripheral extension, centripetal extension, is more commonly seen in case of a fungal infection like chiniasis, which we call as the ringworm, or where there may not be a zone of clearance. It may be a continuous patch-like lesion. It's usually seen in case of the erythema multiforme, which is an allergic immunological mechanism. Immunological conditions. Erythema multiforme is again produced due to multiple causes, allergic causes. So we may consider Indravrudha in both these conditions. Of course, tinnitus, because it has a symptom of itching, it could be considered as something else too. But anyway, as far as the Padma Pushkaravati description, that description of a centripetal extension of the lesion is a very beautiful and very practical clinical description of the lesion. When you use the word centripetal and centrifugal, it may not be easily understood, but when you say Padma Pushkaravata, and if you have that experience of seeing these ponds of lotus, then I think these things are very easy to make out. So initially the first lesion, then it tends to coalesce, multiple lesions tend to occur. Later on, it may become big packed lesion as such. That's the erythema multiforme lesions as such. So I would consider Indravata as the erythema multiforme. Then Gardhabika is another of the lesion where it's again Vatapittaja Vyadhi, where the lesion will be Mandalam, Vrutamutsanam Saraktam Pirakachitam Vrajakarim Gardhabikam, Tam Vidyadu Vatapittajam. Gardhabika is again a chronic abscess. Again, it could be an infected cyst with surrounding reactions. So it may not be different than that of the infected cyst. The only thing is, in this infected cyst, the inflammation may be relatively milder, and there could be surrounding satellite lesions. That's the typical of Gardhabika. So, Gardhabika may be a variety, depending upon the size, and then the size is bigger. Mandalam is circular in shape and the surface is raised. There could be discharges, again hemogenous discharges. That condition is called as the Gardhabika, which again could be an infected cyst only. That's one. Then Shaluka Panasika. Panasika is the next of the condition, where the lesion would be like a seed of a fruit. Shaluka. Shaluka is a seed of a fruit. कर्णोपरि समन्ताद्वा पृष्ठे वा पिडका उग्रदुको शालूकवत्तनसिकां विद्यात् श्लेष्ममात्रजाम्. Again a kapavataja vyadhi where there would be a swelling. Sushruta says it can be painful, a painful condition, and when you open it up, it's as like that of a seed of a fruit, and because it has a comparable appearance to that of jackfruit seed, it's called as panasika. A hard swelling which is free from the tissues, which has a capsule and can be easily separated. Once you make an incision, it can be easily separated and pushed out. That kind of a lesion is quite commonly seen in case of the dermoids. Dermoid is a ectopic growth of a tissue. See, the germinal cell layers, they during the growth of a fetus, you will have ectoderm, endoderm, and mesodermal layers, which tend to fuse together, and then they form the different varieties of the tissues. Ectoderm leads to the formation of the nerve tissue and the skin tissue. Mesoderm, the other connective tissues, as such. Now, the issue is during these folds of the growth, if at all some cells of one plane reaches to the other plane, then it may remain dormant for a long time. Later on, that cell which was in the ectopic plane, like an ectoderm reaching to the endodermal cell or endodermal cell reaching to the ectodermal plane or so on and so forth, it may start growing and that produces a tissue which is not really the same as that of the normal tissue. And these are called as dermites. Dermites again could be categorized as teratomas or simple dermites. Teratomas are those conditions where the tissues present within that lesion could be of multiple, like hairs, growth, etc. Whereas dermats are where there could be a single type of tissue, like in the subcutaneous area, you may see a hard tissue which resembles that of the bone or cartilage. That kind of an appearance could be seen. And in case of the subcutaneous dermats, dermats related to the skin area, they are more frequently seen in the face, and particularly the zones of the dermite in the face are the lines of fusion during the embryonic growth. The embryonic growth tends to be like there will be a fusion in the midline on both the sides, then around the eyes and a line up from the ears to the eyes as a, around the nose and around the tongue or midline. These are the frequent areas where the dermites tend to occur quite frequently, and that's exactly what Susan says. Karno Parisamantadva Priste. These are the frequent areas where the dermites, and dermites usually are painless, hard, firm, easily movable, freely movable fillings, which are usually painless. Sushila says that they could be painful. Painful, of course, they do occur when there is a hemorrhage into the cyst. And when you open it up, the surgical excision, you can see that seed-like appearance exactly the same as described by Sushila. A teratoma often is seen in intra-abdominal area like ovaries and testicles. These are the frequent areas where the teratomas occur, where the teratoma would be having multiple varieties of tissues like hairs seen there or bone and cartilages. Many times the teratoma may even have a fetal organ, a recognized organ like a limb, or at times it could be like a fully formed fetus-like appearance where you may see face and other limbs also, which could be seen as such. And multiple varieties of the cysts could be seen, and these teratomas are more frequently seen in ovaries. They will not be seen on the surface of the body, and these could again be considered as the panacicas as such. Then the next is about the Pashana Gardhava. Pashana Gardhava, Hansandau Sambhutam Shopam Alpurjam Stiram, Pashana Gardhavam Vidyata, Balasa Pavanatmakam. A Kafaja and Kapavataja Vyati, which is seen at the mandibular joint area, Hanasandhi, and it's painless and hard swelling. That's why, because of its hardness, it's called as a Pashana Gardhava. Pashana is stone, Gardhava is donkey, but why that donkey name comes in, I don't know. But Pashana, of course, it's a hard acid. Now, these kinds of the swellings are quite common in case of the parotid swellings. Parotid swellings, again, quite frequently are of two varieties, where there could be sialadenitis, inflammatory pathologies of the parotid gland, parotitis also, or it could be the tumor pathology. Among the tumor, it's a myxoma which is more common. The differences are in the inflammatory condition, there would be painful condition and the swelling would be softer. Whereas the tumor pathologies, they are firm in consistency and comparatively painless. Only when they become very huge, then there could be pain, or the pain could be produced as a secondary effect due to the erosion of the bone or compression of the nerves over there. And among such tumors, the myxoma is quite common. Myxoma is the name comes in myxoma because if you take the histological view, you will find multiple varieties of the tissue, fibrous tissues, glandular tissues, all of them mixed together. That kind of an appearance is very characteristic of the myxoma. It's a slow growing tumor and the incidence also is quite common. And this is another of the condition which we call as Pashana Gardhava. Many of the texts, some translated texts, they translate mumps as Pashana Gardhava, which I don't agree, because mumps are those conditions where there could be pain and fever which have more Pittaja Lakshanas than that of Kapabhati Lakshana, whereas myxomas are the same as that of the Pashana Gardhava. The next is about the Jalagardhava. Jalagardhava is where the condition would be having a resemblance to that of the Visarpa. Visarpa of the Sarpati, yo dahadvara karahatanuhum apakaha shvayatuhu pitta sajnyeha Jalagardhava. Now, in inflammatory swelling which is not localized, we have discussed this issue when we discussed about the Vranashopa as such. There could be, again, non-localized conditions could be of two varieties, cellulitis and erysipelas. Cellulitis where irrespective of the plane of the tissue, it could be skin, adipose tissue or maybe much deeper. You may call as the cellulitis, or when it involves the still deeper plane like fascia, you may call as the fasciitis. When the inflammatory lesion is limited to the skin and part of the skin only, that condition is called as erysipelas, a non-localizing inflammatory pathology, a variety of the cellulitis limited to the skin only is erysipelas, where the patient would have a typical feature of a reddish lesion which tends to spread without borders, and gradually there could be little pus, slightly amount of pus, and the pus is not quite huge as in case of the fasciitis or necrotizing fasciitis, where you will have a lot of slough. Here there may not be slough, only the skin then may gradually tend to peel off, and it may produce a superficial wide wound over the area. That's the erysipelas as such. So Jalagardhava is obviously the erysipelas as a condition. Then the next is iribellica. Iribellica Pirikam Uttamagastam, Vrittam, Atha Ugravijarjvaram, Sarvatmakam, Saralingam, Janiyadi Rivelikam. Urivelika is a lesion which can be presented according to Sushruta in the Uttamangasta, that's the head and scalp area. But we would generalize, it's not limited to the only the scalp area, it can occur anywhere in the body where you will have a lesion which has a severe pain and deep seated, and the symptoms of inflammation also are seen, and all the Tridosha Lakshanas are seen. That's Tridosha Lakshanas are necrosis. That's typical of what we call as a necrotizing fasciitis, a variation of the same. So cellulitis is described in case of the Visarpa, erysipelas is in case of the Jalagardhava, then the necrotizing fasciitis is described in case of the Irivelica, which is the pyoderma gangrenosum, or the necrotizing fasciitis. The other name is a pyoderma gangrenosum, where you have the pus condition involving the skin as well as the gangrenous changes. It's the same thing. The only issue which is different from what Sushra has said is, Sushra has said the lesion is in the scalp, but we can see it anywhere, both on the scalp or elsewhere too. The lesions can be seen. There is no limitation, or there is no such statistical factor which says that it's more frequent in the scalp area. Then comes the kaksha. Kaksha, bahu parshva amsa kaksha. So, krishna spotam savedanam, pitta prakopa sambhutam kaksham iti vinirnisheta. Kaksha is a swelling which is present in the areas of lymph node aggregations. The bahu parshva, axilla or kaksha, the inguinal area, and the amsa, the scapular, subscapular region. These are the areas where the lymph nodes are aggregated. Along with that, of course, one more area where the lymph nodes are aggregated are the cervical area, where you will have a huge number of lymph nodes in a small area. So when Sushruta says Bahu Parshva Amsa, Kaksha, etc., we will have to consider this as areas of lymph node aggregations. Lymph node aggregation in the sense, a large number of lymph nodes are present in these areas. And Krishna spotam, which represents as a blackish swelling, painful, and produced with a pitta prakopa. That's typically what we see as a lymphadenitis. Lymphadenitis, where lymphadenitis could be of two varieties, reactive and infective. Reactive lymphadenitis doesn't present with the clinical symptoms of inflammation, reddish discoloration and pus formation doesn't occur, whereas infective lymphadenitis results in the pus formation. Reactive and infective both tend to occur due to the transmission of a infective substance from its draining area. Usually it's a wound in the draining area which results in inflammation. When the inflammation doesn't produce any infection in the lymph node, the bacteria do not multiply in the lymph node. Is a reactive lymphadenitis where there will be no pus formation. It's a self-limiting disorder. Once the primary area of inflammation is healed, it heals as such. Whereas it may result in a pus formation and the lymph nodes may get destroyed or destructed. That's in case of the suppurative lymphadenitis or pyogenic lymphadenitis, and it can occur anywhere. It's a common issue as such, and quite frequently seen in the axilla. Another condition which may have a similar appearance without the lymph nodes is a hydradenitis. Hydradenitis where the sweat glands are infected and you will find multiple small nodular lesions and very frequently seen in the areas like axilla or the inguinal area, because they are the areas where the skin folds are there and hygiene is difficult to be maintained. So it could be both the ways, maybe hydradenitis or lymphadenitis, but more frequently I would consider kaksha as the lymphadenitis. Now, ekam evam vidham drishtva pitikam spotasanibham toggatam pittagopena gandhanamam pratyakshare. When a similar lesion is seen as single lesion and not multiple, and is relatively superficial, that's called as gandhana. Now, of course, whether it is a single or multiple, that depends upon the type of the pathology and the lesion present in the draining area. I would consider this also a variation of lymphadenitis or hydradenitis. Hydradenitis, when it becomes chronic, you will have multiple lesions accumulated together. In the beginning, it may start as a single lesion. So that name of Gandhanama or this Kaksha, it will be depending upon the presentation of the patient at that moment. So from the present day's point of view, these could be considered as two stages of the disease, whereas Sushil has named these as the two diseases as such. That's a very common issue. In many other contexts also we have discussed that kind of a difference of perception, and it's not a very huge issue. Then comes the Vispotakaha. Vispotaka Agnidagdhanibaha Spotaha Sajvaraha Pittaraktaha Kvachit Sarvatravadehe Smutaha Vispotaka iti. Now Vispotaka are where they will have vesicular eruptions which look like the scars of burn, and they present with the jara and all that features of Pitta Prokopa. This is typical of the pemphigoid lesions. Pemphigoid lesions are, again, there are two varieties, pemphigus and pemphigoid. Pemphigoid is relatively less virulent in pathology, which is again autoimmune origin, where there will be sudden crop of these vesicular eruptions seen and they are presented as bullous. Initially there will be erythema and then they present with the bullous lesions as such. Large bullae could be formed anywhere and they may be self-limiting. In due course of time it may heal, and the characteristically in a pemphigoid, the oral mucosa is not involved, it's limited to the keratinous skin tissue only, then we call it as a pemphigoid lesion, and it's also quite common. Whereas pemphigus is the other variety where the lesions will be widespread and the prognosis is poor, and they can be involving the mucosa, oral mucosa also. Now that condition is called as Agnirohini by Sushruta. कक्षाभागेषु ये स्फोटाः जायन्ते मांसदारुणाः अन्तर्दाः ज्वरकराः दीप्तपावकसन्निभाः सप्ताहाद्वा दशाहाद्वा पक्षाद्वा घ्नन्ति मानवम् ताम् अग्निरोहिणीं विद्यात् असाध्यां सन्निपाततः. A asadhya vyadi which can be fatal, and Sushruta says it can produce a fatal issue by 1 week or 10 days or by 2 weeks as such pakshadva. So anyway, whether it's really fatal or not, that's a different issue. In the present day situation, you can manage with the steroids to a certain extent, and with the steroids you can pull on, but it's a steroid dependent disease, and hence the condition would be prognosis is comparatively poor. Typically, it presents as a vesicular lesion, as in case of the pemphigoid, but the only difference would be it can be widespread and later on it peels up, produces superficial ulcers, and there could be secondary infection, and the lesions are widespread, very virulent, and very rapidly growing. That's the pemphigus vulgaris. Also, it's an autoimmune disorder. And that's exactly what Sushruta says, like it's antardah jarakarah. Septicemia is a more frequent complication of these conditions, pemphigus like condition. That's about the pemphigus Agni Rohini as one of the variety. With the word Agni Rohini, there is a bit of another issue. In Vagbhata, Agnirohini is considered as a name of Pittaja Visarpa. In the Visarpa, Pittaja Visarpa, Agnirohini is considered as a name for the Pittaja Visarpa. That's the other part of it. Of course, that doesn't make much huge difference as such. Now the next is about the Kunaka or Kulina. Kunaka and Kulina are the synonyms for the same. The reason is Nakhavantam Adhisthaya, Pittam Vatashcha Vedana, Karoti Dahapakoja, Tam Vyathim Chippam Adishet, Tadeva Akshatarogakyam Tata Upanakamityapi, Abhigata Pradusto Yo Nakho Ruksho Asita Karaha, Bhavetam Kunakam Vidyat, Kulinam Iti Sanjitam. Kulina, Kunaka are the synonyms, whereas Chippa also are Akshata and Upanaka. These also are the synonyms. The difference between these is Chippa, Akshata, or Upanaka words are used when it's a spontaneous produced condition. A similar condition which is produced as a result of the trauma is considered as Kunaka or Kulina. So, trauma or non-traumatic nail bed infections, infections of the nail bed, which tend to produce painful accumulation of the pus around the nail bed. That's the what we call as a paronychia. Paronychia is the current name used for the nail bed infections, where and it's quite frequent. And now, what we see more frequently as a result of the trauma. So, kunaka or kulina, that word is given when it is abhigata, when it's produced the trauma. The other names like Chippa, Akshataroga, or Upanaka are named when there is no history of trauma. From the present day's point of view, we see more of the conditions as the effect of the trauma, where there will be accumulation of the pus in the nail bed and quite painful. Unless you drain the pus, the pain will be quite severe, and in long term, it can affect the health of the nail bed, and future growth of the nail could be affected. The appearance of the nail also could be affected as such. Then the next is about the Anushayi. Anushayi is Gambhiram Alpasamrambam Savarnam Uparistham Kapad Antaprapakam Tam Vidyal Anushayim Shaka. It's a Kafaja Vyadhi and it's a Gambhira, deep seated Alpasamramba. The symptoms of pain would be relatively lesser. Savarna, it can be having the same color as that of the normal area. And the Prabhatam, the first scene or the first formation is a scene, but it's somewhat concealed, not very obviously seen. Present day situation, we use the term cold abscess. The word cold abscess doesn't mean that the area is cold. It's the same inflammatory pathology. The pus will be formed, but the clinical signs of inflammation are mild. Cold abscess could be produced due to organisms like tubercular. Very frequently, tubercular pathology results in a cold abscess. Or there is another variety of the same which you call as the antibioma. Antibioma is a typical purulent infection which is treated with antibiotics but not drained. The pus accumulated could result in a hardened situation or where the borders would be hardened, and it can occur anywhere in the body. Here, of course, I have given you image of the breast subcutaneous or the chest over the chest area, where you will have that kind of a pus formation, a relatively painless swelling, which tends to gradually increase as it. Ultrasonography can make out exactly the presence of a capsule, and then that thick pus is seen. That's the typical appearance of the cold abscess, and of course, the total course of the treatment will be the similar. Only thing is you need to rule out the tuberculosis or even antibiome also. Both the conditions, there is a need of drainage followed by the specific treatment. So that's about the cold abscess, which is Anushayi according to Sushila. Then Vidari Kandavat Vrittam Kaksha Vakshana Sandishu Raktam Vidarikam Vidyat Sarvajam Sarvakshanam. A Tridosha variety of lesion where the swelling is presented like a Vidarikanda, that's a human-like swelling seen over the surface, and it can again seen quite frequently in the areas of lymph node aggregation, Kaksha Vakshana Sandishu. When there is a specificity of Kaksha Vakshana, it's suggestive of a lymph node aggregation, and in such conditions, it's considered as a Vidarika. It's very typical in case of the condylomas. Lymphogranuloma venereum, in the venereal diseases, like lymphogranuloma venereum is one of the condition where there will be a typical swelling in the inguinal area, and later on it can result in a condyloma, that papilloma virus like consequences could be occurring, and you'll see that projection. So that's very typical, and Vidarica can be considered as a is of this sort, and the size of the swelling is quite big in case of this condyloma and lymphoblastic both the conditions. The size is quite big, and comparatively they are initially they will be painful, but later on they will become painless and relatively firm consistency. And of course, the major complication would be systemic complications which can occur at the later phases. Of course, there is a relationship with the sexual behavior of the persons, which is not mentioned in case of the Vidarika. Sushruta has not mentioned that part. But now, when we say lymphogranuloma venereum, it's a disease related to the venereal factors, sexually transmitted disorder. Then the next is about the Sharkara Buddha. The word Sharkara or Buddha comes in because of the hard and Sharkara, like crystalline contents. प्राप्य मांसशिरास्नायुः श्लेष्मा मेधस्तथा अनिलः ग्रन्थिं कुर्वन्ति भिन्नो असौ मधुसर्पिवसानिभं स्रवति आस्रावमत्यर्थं तत्र वृद्धिं गतो अनिलः मांसं विशोष्य गर्तितां शर्करां जनयेत् पुनः दुर्गन्धं क्लीनमत्यर्थं नानावर्णं ततः शिराः स्रवन्ति सहसा रक्तं तद्विद्यात् शर्कराबुधम् is a very chronic lesion which usually starts in the deeper tissues like tendons and ligaments, Mamsasirasnayu, and or maybe the other tissues where there will be a cyst-like swelling, which may initially contain a substance which looks like madhu sarpivasa. It could be like ghee or certain gelatinous substance could be seen in the beginning, but later on, if it is not removed completely, it can result in a situation where it can dry up, the contents can dry up and produce a hard swelling which looks like a crystal. So, this process of a crystallization of the contents of a cyst, now particularly ganglion or sebaceous cyst in both the conditions, in any of the cyst conditions it can occur in a ganglion which is typically produced in the tendons as a result of degeneration. Initially, it will be painless, and when you open, you will see typically gelatinous substance, Madhusarvasanika. One of the complications could be it may become calcified, which can be identified by a CT scan image, radiology image, and then it is exactly the Shakara. In a sebaceous cyst also it can be a similar issue, and in the sebaceous cyst, because it's superficial, when it becomes hardened, you may see that hard projection over the surface, and this is named as Cox peculiar tumor. Now, we use the word Cox peculiar tumor, very specific to the sebaceous cyst which has become hardened and inside a projection which looks like the Cox head, collet. So that kind of an appearance is seen, and that's exactly the Sharkara Buddha. As the time is up, we have some other commitments, so we'll wind up today. We'll continue in the next session after this Shakara. If there are any questions, I will try to answer, and then we'll wind up today. Right, there are no questions. How to differentiate clinically Sannipataja Bhidrati and Irivelika? Of course, it is the same. Both Lakshanas are the same. So, Sannipatika Bhidrati itself can be named as Irivelika, the other name. So, it's obviously the same issue. No differences. When comparatively the size is smaller, it could be considered as a kshudraroga. When the size is bigger, Bhidrati is deep-seated, then it's considered as a Sannipataja Bhidrati. So, Bhidrati is deep-seated, Irivelika is very much superficial. From the current point of view, they are the same, like infected ulcers, infected conditions. Then Agnirohini, site of lesion given is a Kaksha Bhaga. Can we consider herpes infection, sir? Okay, see, herpes infections, that's one thing which you see in case of Pitta Visarpa Lakshanas of Sushruta. That's very typical. And when Sushruta says about a specific area like Kaksha Bhaga, it need not be very rigid. We can just extend it to the other areas. Pemphigus vulgaris affects all over the body. That's absolutely true, including the mucosal involvement. And of course, now this whether it has to be considered as a variety of Visarpa or not. This question, I think we have answered in the context of Visarpa Vyadi. Pemphigus, definitely yes, I would consider this as a Tridoshida Visarpa also. whereas it's also considered as a Vispotaka as a Kshudra Vyadhi. So Kshudra Roga and other diseases, the naming of the other diseases, there is always a overlapping issue. And in case of the Kushta, it's very specifically mentioned. It's only about issue of naming the conditions. Then cold abscess as a Kapha Vidrati. Yeah, of course, Anushay. Kapha Vidrati also is definitely, yes, it's considered as a cold abscess. Now, again, the same point. See, when Sushruta has named those Kshudra Rogas, it's exactly the diseases which are mentioned in other contexts as such. And the only issue is when it's a Vidrati is a deep-seated lesion, whereas the Kshudra could be maybe anywhere superficial or so on. So then there is another question. Can we consider all cystic swellings under the umbrella of Granthi Rogas? Yes, of course. Granthi in general can be considered Kshudra Roga. This is a issue which we have discussed in the previous chapter when we discussed about the Granthi as such. And Panasika also can be a Granthi, yes, Kapaja variety or Medhaja variety of the Granthi. So this is exactly the same point. Like again, we come to the same issue. Kshudra Roga, there is always a confusion with the naming of the diseases. Teratoma is benign or malignant. Of course, teratoma can be malignant in due course of time. It's initially benign. Later on, it can be malignant as such. Then between cyst in ovary and teratoma. See, ovarian cysts are again either it could be plain cysts where there could be a clear-cut fluid, or it could be like having hemorrhages. They are produced due to the dilatation of the follicles. Ovarian cysts are a failure of shrinking of the follicles at the end of that ovulation, and which may become dilated. Teratoma is due to the growth of this ectopic tissue is the teratoma. That's the difference between ovarian cyst and the teratoma, right? So I think that's about all the questions which are answered. Right. Okay, we'll conclude today.